Live from the station of BLSMHSI College of Nursing. This is BSN 2022. Radio on the go, nurturing lives with you.
Time check. It is now the perfect time for learning about your health. Good day, future board top-notchers. This is Angelika SAUL, and you can call me Student Nurse Gege from DLSMHSI College of Nursing.
What's up, future board top-notchers? I am Yuan Lloyd Samin, and we will be your student nurses on air for today on BSN 2022 Radio on the Go, nurturing lives with you. So for today, we will be emphasizing our segment about a very prevalent lifestyle disease that Filipinos are very prone to. We will be noting important details pertaining to the third most common cancer in the Philippines, known as liver cancer.
That's right, Student Nurse Yuan. Now let's get ready for another session filled with worthwhile learning. I am very thrilled today because we have a guest student nurse.
Yes, we have a very special guest for today. She will give us more details on how to prevent and manage liver cancer. But before that, let us now start our session for today in BSN 2022 Radio on the Go, nurturing lives with you. With the theme, Nasa iyong kamay, kalagayan ng atay.
Liver cancer in the Philippines remains to be a silent epidemic, as many Filipinos are diagnosed with this prevalent lifestyle disease. According to the World Health Organization, liver cancer is the most common leading cause of mortality worldwide, that increases gradually with an approximate incidence of 850,000 new cases per year. Liver or hepatic cancer, which originates in liver cells, is the third most common cancer in the Philippines. It is the second most prevalent among men and ninth among females in the country. This is according to the Department of Health. Liver cancer, also known as hepatic or primary liver cancer, is a type of cancer that originated in the liver. Some other cancer cells develop in another part of the body, then spreads in the liver, that it is known to be as the secondary liver cancer. Gender, alcohol, aflatoxins, HBV or HCV virus, environment, race or ethnicity, diabetes, and obesity. So that's all for the brief background and risk factors regarding liver cancer. Back to you, Student Nurse Yuan.
Thank you, Student Nurse Gege. Let's now move on to the signs and symptoms of liver cancer. The following are signs and symptoms of liver cancer: sudden weight loss, loss of appetite, nausea or vomiting, enlarged liver and spleen, abdominal pain, pain near the right shoulder blade, itching, swelling of the abdomen, jaundice, and abnormal bruising. So these are the signs and symptoms that will manifest on a client with liver cancer. We will be right back after a short break.
Naninilaw na ang balat, nilalagnat ka pa, lumalaki ang tiyan, nang hinap ka, hala. Baka nga'y tinamaan ng atay, deliks na ang iyong buhay. Ngunit huwag kang mangamba, bisyo'y itigil na, mamuhay ng tama at magpa-check up ngayon na, para ay maagap ang sintomas at mabigyan ka ng lunas.
Ito ay paalala sa atin ng College of Nursing na alagaan ng atay para di maging kalansay. Laging tatandaan na live longer, alagaan ang liver. And now we're back at BSN 2022, Radio on the Go, nurturing lives with you. Moving on with our session, it is now time to introduce our guest student nurse.
You're right, student nurse Yuan. Let us give the spotlight to the College of Nursing's very own student nurse, Miss Yzabel Restrivera.
Thank you for inviting me, my co-student nurses. So now I will be discussing on how to prevent and manage liver cancer. Preventive measures include immunization with the hepatitis vaccine, limiting alcohol intake, limiting tobacco use, maintaining a healthy diet and weight, exercising regularly, improving food sanitation, and avoiding risk factors. There are many forms of treatment available for liver cancer depending on the extent or stage of the disease, as well as the patient's age, overall health, and personal preferences. Tumor removal and liver transplant are some surgical options. Radiation therapy destroys cancer cells and shrinks tumors. Targeted drug treatments focus on specific abnormalities present within cancer cells. Immunotherapy uses your immune system to fight cancer. And chemotherapy uses drugs to kill rapidly growing cells, including cancer cells. Localized treatment options for liver cancer include heating cancer cells, also known as radiofrequency ablation, freezing cancer cells or cryoablation, injecting alcohol into the tumor, injecting chemotherapy drugs into the liver or chemoembolization, and placing beads filled with radiation in the liver. So that's all for the preventive measures and treatment for liver cancer. I hope that you will all be mindful of your lifestyle and health behaviors in order to avoid having such disease. Thank you for inviting me, student nurse Gege and Yuan. And lastly, good luck to all of you, future board top-notchers.
And that's our session for today. Thank you, student nurse Yza, for joining us in our mission to provide health education regarding liver cancer. I am sure our future board top-notchers learned today. Once again, I am your host, Angelika SAUL from the College of Nursing.
And I am your student nurse on air for today, Yuan Lloyd S. Samin from the College of Nursing. Our final message to our future board top-notchers is that, in order to live better, ingatan ang liver. This is our program, BSN 2022, Radio on the Go, Nurturing Lives with You, with the theme, Nasa iyong kamay, kalagayan ng atay.